I'm Kyla Thomson, and I'm from Swift Current, Saskatchewan, Canada, and I'm a medical mom to my daughter Bella, who is almost 10 years old. And I also have a son, Waylon, who turns 5 next week. And my husband and I, we run a tree farm back home. And I've been medical momming my daughter for since she was born, so almost 10 years now. I think if I were to sum it up to something really simplified, it would be dead cells of the colon. So your colon is basically forming a blockage because it's dead cells and it doesn't work. And the Hirschsprungs is either a section of the colon or in Bella's case, the entire colon. And from what I've learned with her rarity, they've called her form of Hirschsprungs long segment Hirschsprungs. So it affected her entire colon, which is, I think, affects less than 5% of patients or pediatric patients. And they also believe that it had skipped into her small bowel as well, which they had never seen before here at Sick Kids. And now I'm wondering as well, now that, we're thinking like Bella's had her transplant, she has new bowels that are working and are not affected by Hirschsprungs. So I can say she doesn't have Hirschsprungs anymore.
Wow.
Our surgeon at the time that did Bella's first surgery on her colon, she was 3 days old. And so she had not pooped yet, and she was vomiting and vomiting and vomiting. So he had thought right away, okay, and she had quite a distended belly. He knew, like, before going into the OR, he was very certain this was Hirschsprungs and he had seen it before. The issue with Bella is we never knew how much of her colon was affected. Every surgery, every few months, they would take just a little bit of her colon, only seeing the actual affected colon. So she had a surgery at 3 days old. And what kept us in hospital for so long, the first 2 years of her life, was the fact that they never ended up taking all of the affected bowel out. So they would take a little bit out of what they thought was affected. They'd sew her back up. She'd have an ostomy. We'd have the continued problems. They'd go back in and try and see if there was more in there. I know a lot of our Saskatchewan team at the time, and then our Alberta team at the time, both doing surgeries on Bella's bowels. There was quite a difference when they could do the surgery in Alberta, because I believe there was a specific machine in the OR that flash freezes the cells and can say, okay, here's the affected part. But in Bella's case, I think that wasn't available at the time, and well, at least not for the first year of her life. So it was really her first 5 bowel surgeries were almost exploratory as well as emergency, trying to make sure they got all the affected colon. Yeah, it really was really difficult in the beginning, like her being born with it. She needed an NG tube, like a feeding tube down her nose and throat for the first year of her life. And that really caused oral aversion with her, which made her as an infant not want to feed, not want to drink or eat. There's a lot of pain involved in her throat and a lot of uncomfortable with the vomiting and having tubes in her throat. So she worked really hard to just learn how to eat and drink because of this bowel disease. When we thought we had handled it, we could take the NG out, more issues would come up that would make her NPO, not allowed to eat because of distension, and more issues causing her to be in hospital and need IVs. And so essentially, until she received her bowel transplant, she was surviving off of IV nutrition. And so that also has effects on other organs, that can have an effect on her liver. So we're constantly checking her liver because she's on TPN to survive. That having Hirschsprungs and then needing IV nutrition to survive essentially caused end-stage SVC syndrome for her as well. So, you always wish you could know the future to prevent this. Had we known she would need to survive off of IV nutrition for 9 years of her life, it would have helped us sort of combat that, knowing that SVC syndrome could happen. So what that is she kept going in for bowel surgery. We were thinking things were good. They would take the IV, the permanent IV out, and that would leave scar tissue, making whatever vessels we needed for more IV nutrition unable to use. So 10, 12, 15 CVCs later, so these are the permanent IVs, and your SVC is the main vessel to your heart. And then it has a branch out of just a few larger vessels that they can put these lines in. And we lost all of them because of scarring. And, some needed to come out. And when they would try to put more in, there's just too much scarring and it wouldn't work. So that really affected her chance at receiving a bowel transplant. It was pretty scary for a while, knowing that with end stage SVC syndrome that a transplant might not have been capable or doable for her. So yeah, Hirschsprung's really snowballed a lot of serious issues that kept her in hospital. It's already done so much for her by taking away daily pain. Hirschsprung's would cause, it caused her bowels to fail. And in that failing, they would cause her immense pain on a daily basis. It made it hard for her to eat. It made it hard for her to function, go to school, see friends, sit down for a family supper. It was all, there's so much pain on a daily basis for her. And now that is gone. Her new bowels work and continue to not cause any daily pain. She was also born with SCID. And so a complication post that, no immune system, she needs monthly infusions, I call it immune boosters, but it's IVIG. And her old bowels she would receive immune globulins, and her old bowels with the Hirschsprungs affecting them would just dump this out of her system. But now that she has new bowels, she can hold on to that protection for her immune system. So that's huge as well for her. She doesn't need, we've already gotten rid of so many medications that involve injections, like needles, a whole bunch if you can believe it. I know there's a lot of meds that come after transplant, but she was on a lot, and a lot of those that were harder to do or she doesn't have to do anymore. And eventually, as she recovers, she won't need an ostomy anymore. She won't need her central line anymore, which is now in her leg. So all of her upper access is gone, like I'd mentioned before, but eventually she won't need that. And maybe down the road, she won't even need her G-tube button too. So just a life of a lot less time in hospital. Bella was born in 2013. And at the time in Saskatchewan, we didn't have a pediatric GI specialist. We had our surgeon, who was thankfully very versed in Hirschsprungs, but there was no bowel specialist at all. And also for her SCID condition, there was no bone marrow transplant capabilities in Saskatchewan either. So for a few reasons, they needed to move us out of province to Alberta, especially for her bone marrow transplant. But we had a team in Calgary that was a GI specialist team that was very, very good, that has been our primary bowel team for her whole life. And they were the ones that were able to say, okay, Hirschsprung's is called bowel caused bowel failure, we need to have Sick Kids in Toronto assess her for transplant. And so being able to be listed for this type of transplant, the only facility that can do that is Sick Kids in Toronto. So it wouldn't really matter where we were living in Canada, we would have to be here for the transplant. I really hope that the primary amount of our viewers that are, medical parents in hospital or caregivers, and the kiddos that they're there for, can take some laughs and some smiles and some inspiration and some joy from our content. Like, number one, that means a lot to Bella and I, because that's what we understand what it means to be in hospital for long term. And even if you're not in for long term, it's hard. So we really just want to be a source of joy for other families like us that have to stay in hospital. And then apart from that, I've always really wanted people to understand my daughter's medical life. It's been from birth for her, and I didn't want her to have to grow up explaining such, taking energy to explain so much of what she's been through to other people. I thought it'd be better that, if I can explain it now, the more this world understands what kids like Bella go through, the more support she'll be able to receive through this journey, since it is such a long journey for her. And it's lifelong now, right? Like any transplant recipient family knows that's a lifelong medical life. And I really just wanted the world to really understand her, support her, and not just question her. For those that have the time and energy to support us on our journey, and that means a lot that people take the time to care about that aspect for us. It is quite a lot, and it'll continue to be a lot. I know right now, looking at our future outside of recovery, outside of hospital, there'll be a lot of expenses for her with her continued medication and supplies needs. So thank you for thinking about that and helping us. The link in our bio for our TikTok and our Instagram gives all the links that help support Bella. So there's our PayPal, there's our merch, which we've designed as a family, which has been so fun and so rewarding to see not only my daughter's name out there, but the Be Brave message helping other people. And so 50% of all of our merch goes directly to helping Bella and supporting her. And yeah, so you can find our links on our link tree. Our Instagram and our TikTok are both at Kyla CT.